Assalamu alaikum rahmatullahi wa barakatuh. Dear students, I am Dr. Rahma Kamal Abu Noor. I'm going to give you a revision for the microscopic slide for the second year, modules 206 and 205. The 206 is the digestive and the urinary, and 205 is the CNS and the nervous tissue. If I'm having rounded structure with a lumen, okay, here is a tube and I cut this tube TS. So this section will appear as rounded structure with lumen. How can I identify them? Look to the lumen. Look to the lumen. If the lining epithelium is non-keratinized stratified squamous epithelium, we are talking about esophagus. And we have two types of esophagus, esophagus dog and esophagus cat. How could I identify them? If I can see mucosal glands in the submucosa, it is esophagus dog. Well-developed muscularis mucosa, it is esophagus cat. Again, how you can identify the non-keratinized stratified squamous epithelium. This is the basement membrane. Here is the nucleus. First, they are basal and oval, then they are rounded, then they are flat. If the lining epithelium is transitional epithelium, if the lining epithelium is transitional epithelium, it is urinary bladder. How could I identify the transitional epithelium? Non-clear, non-wavy basement membrane, and then the epithelium, all the epithelium has rounded nuclei. All of them has rounded nuclei. Again, this is the non-keratinized stratified squamous epithelium. This is the non-keratinized stratified squamous epithelium. From where you know, clear, wavy basement membrane, more than one layer of nuclei. The first one is oval, then rounded, then flat. So I'm going to think it is the esophagus. We have two esophagus, esophagus dog and esophagus cat. How could I identify them? Between the epithelium and the musculosa in the submucosa, there is esophageal glands in the esophagus dog, while in the esophagus cat, it is well-developed muscularis mucosa. Well-developed muscularis mucosa. Again, esophagus dog, non-keratinized stratified squamous epithelium. In the submucosa, there is esophageal glands. This is the esophagus cat. From where you know, well-developed muscularis mucosa. Dear student, this is a very nice picture in which I put the stratified squamous versus the transitional in order to differentiate between the two types of stratified epithelium. Here, non-clear, non-wavy here clear wavy basement membrane and the nuclei, first oval, then rounded, then flat. Here, non-clear, non-wavy basement membrane and all the nuclei are rounded. An example for the transitional epithelium, large rounded structure with transitional epithelium in the lumen is the urinary bladder. What are the criteria of the urinary bladder? It's formed of mucosa, which is formed of the epithelium and connective tissue corium. Then the musculosa, which is formed of inner, outer, longitudinal, and middle circular. Folded mucosa lined with transitional epithelium, and I don't have submucosa. Then we have the musculosa, inner, outer, longitudinal, and middle circular. If the lumen, I can see the villi and crypts. It's either the duodenum or the ileum. If I'm having Brunner's gland in the submucosa, it is duodenum. If I'm having Peyer's patches, it is the ileum. Okay, again, this is the villi and this is the crypt. The villi projecting on the surface, the villi projecting on the surface, while the crypt between them is the connective tissue. If I have crypts only, it is large intestine, and the crypts are large deep, wide, and full of goblet cells. I can see in the large intestine, tinea coli, appendices, epiploidy, solitary lymph follicle, but the main criteria is that I'm having folded mucosa, deep crypts, deep and wide crypts, and many goblet cells. If I'm having villi and it's either the ileum, here are the villi and these are the crypts. On one side, which is the antimesenteric side, I can see in the submucosa lymphatic follicles, which is known as the Peyer's patches. Here at the duodenum, this is the villi and this is the crypts. In the submucosa, I'm having a mucosal glands, which is I'm having mucus secreting glands, which are the Brunner's gland, which is present in the duodenum. If I'm having only, we are talking about the large intestine. The mucosa is folded, the crypts are wide and deep, and full of goblet cells. The cytoplasm is vacuolated due to goblet cells. Here, dear students, I'm having sometimes the crypts cut LS and sometimes TS. But the most important criteria for the large intestine that is has folded mucosa and the crypts are wide and deep and full with goblet cells. If I have a structure covered by skin, I know the skin, keratinized stratified squamous epithelium, and these are the hair follicles. I'm having two slides, the lip and the eyelid. Here the lip, one side is covered with skin, and I can see here the keratinized stratified squamous epithelium. These are the hair follicle and sebaceous gland. Other side is the mucous membrane, and here is the labial glands. In between them, this is a marginal zone between the skin and the mucous membrane, and this is the red margin. You can see here deep dermal papillae, and there is no hair follicles. And this is the main criteria to differentiate between the lip and the eyelid. Here the eyelid, one surface covered with skin and the other the palpebral conjunctiva. Here is the muscle layer and here is the meibomian glands. The most important feature here is this is the lid margin, in which I can see hair follicles, which are the eyelashes. Here is a muscular structure and covered with partially keratinized epithelium, stratified squamous epithelium, which are the papillae. Most of the papillae are filiform papillae and have few fungi-form papillae. This is tongue human or tongue. If I can see lobulated structures, so we're talking about glands. Here is the liver. It's formed of central vein radiating from it acidophilic hepatocytes. I cannot see trabeculae, so it is liver human. And there is another structure which is anatomically related to it, which is the gallbladder. Highly folded mucosa, liver and gallbladder. Dear students, if I'm having serous acini, small acini, non-clear cell boundary, rounded nucleus. So we are talking about the serous acini. I'm having two glands, which are the parotid and the pancreas. So I should differentiate between them. How could I differentiate? Please, students, look at the trabeculae, the acini, intralobular ducts, and the islets of Langerhans. Here is the pancreas. From where I know, this is the acini. The acini has acidophilic, apical acidophilia and basal basophilia. I cannot see here intralobular ducts, and the trabeculae is thin, very thin trabeculae. This is not a trabeculae, it is an artifact. And this is the islets of Langerhans. This is a high power, just I want to tell you about the apical acidophilia and the basal basophilia. While the parotid gland, the acini, the serous acini, is basophilic. Here is the trabeculae, thick trabeculae, and here are the intralobular ducts, and here are the intralobular ducts. If the gland show mucus acini, which is large in diameter, wide lumen, the clear cell boundaries, and the nuclei is basal and flat, it is the submandibular gland of dog. If I see Malpighian renal corpuscle and tubules, it is kidney, and the kidney appears as kidney-shaped structure. Kidney-shaped structure. If I see a strip, what the meaning of strip? Like this. I'm having two organs, the fundus and the pylorus. How could I differentiate between the fundus and the pylorus? The fundus is folded, the pylorus is less folded. The fundus, the pit, is thin and shallow. This is the pit, thin and shallow. The pit to the gland ratio 1:3 or 1:4, while the pit in the pylorus wide and deep. The ratio between the pit and the gland about 1:1. Here the glands are crowded and colorful due to presence of peptic, parietal, and mucus secreting, while here the glands are not crowded. I can see connective tissue between the cells, the glands, and most of the glands lined with cells mucus secreting, so it appears pale. The submucosa of the fundus is large, while that of the pylorus thin. The musculosa of the pylorus is larger than that of the fundus. Again, this is the fundus in which the crypt is thin and shallow, with the pit to the gland ratio 1:3. Here is the pit of the pylorus wide and deep. The pit to the gland ratio 1:1. Compound structure. What do I mean by compound structure? Anatomically related structures. We have a liver and gallbladder, and duodenum and pancreas. If I have slide in the exam, a fixed slide, you're not allowed to move this slide. We have crypts of large intestine, from where you know, wide deep crypt, and there is full of goblet cells. Classic hepatic lobule. The functional unit of the liver is the classic hepatic lobule, which appears hexagonal in shape, and there is a central vein radiating from its hepatocyte. Serous acini. Serous acini, they are small, basophilic, rounded nuclei. Non-clear cell boundaries. Mucus acini, large, pale vacuolated cytoplasm, clear cell boundaries, and this is the flat basal nucleus. Here is the Purkinje cells that present in the cerebellum. Purkinje cells in the cerebellum. Here you can see the molecular layer, Purkinje cell layer, and the granular layer. Okay, the Purkinje cells appears pyriform and contains processes, and their presence in one layer. Here is the cornea formed of 5 layers: non-keratinized stratified squamous epithelium and simple squamous epithelium. 2 membranes, Bowman's membrane and the Smith's membrane. In between them, the substantia propria. Here is the retina. This is the sclera, and this is the pigmented part of the choroid, and this is the rods and cones. Okay, and here is the outer nuclear layer, outer plexiform layer, inner nuclear layer, inner plexiform layer, then the ganglion layer. Here is the organ of Corti. Here is the basilar membrane. Here is the tectorial membrane. Here is the vestibular membrane. So this is the scala media. Here is the scala vestibuli, scala tympani. Here is the outer and inner pillar cell, outer inner pillar cell, outer inner pharyngeal cells, and here are the outer hair cells and inner hair cells. If I have a small rounded structure with lumen, it's usually fixed. It's difficult to see it under the microscope. It will take a time, so we fix it to put it to be easily seen. We have 4 sections. For this modules, we have only 1. The others are going to take it in the male and female and endocrine. Here is the ureter from where you're going to know. I'm going to ask myself 3 questions. Look at the mucosa. It is folded. Why it is folded? As it contains longitudinal folds. When I cut it, TS appears like this, as if it is star or cross. Number 1, folded mucosa. Number 2, lined with transitional epithelium. From where you know. Number 1, non-clear, non-wavy basement membrane, more stratified cells, and the nuclei are rounded. And the musculosa, there's no submucosa, and the musculosa is moderate in size. We have this small microscope to see the CNS lights, which are the cerebrum and the cerebellum. Dear students, is the cerebrum. It's formed of sulci and ganglia. It's formed of outer gray matter, which is the cortex, and inner white matter, which is the medulla. Here, dear students, is the cerebellum. What is the feature of the cerebellum? The section appears as if it is tree-like appearance, as it contains many folds known as folia. It is formed of central white matter, which is the medulla, covered with the gray matter, which is the cortex, that's formed of molecular layer, Purkinje layer, and the granular layer, which appears dark, contains the granular cells and Golgi cells. About the nervous tissue. Here is the nerve trunk. It's also a small structure, so it is fixed under the microscope. It's formed of bundles. Each bundle is formed of the axons surrounded with myelin sheath, which appears unstained, and the nuclei is the nuclei of the Schwann cells. If I want to see the myelin sheath, I'm going to stain it with osmic acid. The small rings are the myelin sheath. Nerve trunk stained by osmic acid. You should say the stain. It's important to say the stain. Here is the spinal ganglia. From where I know it, thick capsule. The cells are unipolar, different in size, some of them large, some of them small. They are arranged in groups or in rows. Here the spinal ganglia stained by silver, and I can how to differentiate the spinal ganglia from the sympathetic ganglia, as both of them stained with silver. Number 1, these cells are variable in size. We have large and we have small, arranged in groups or in rows. Sympathetic, all of them small, uniform, and they are scattered. Small, uniform, and scattered. Thank you, dear students.